3, 2, 1. Good afternoon. Today is Tuesday, November 21st. It's the Public Health and Safety Committee meeting. We do have a quorum with myself, council members Benton, Bradford, Gregg, Huffman, Nash, and Prepty. We'll have two guests today, so before we get into that part of our agenda, we'll start off with the consent agenda that I have. And so if there's anything on here you'd like me to pull off of consent, please let me know after I read the item numbers. RS 2023-101, so item number 1. Item number 2, which is 108. Item number 3, which is 109. Oh, I'm sorry, not number 3. Scratch that. Number 4, 110. Number 5, 111. Number 6, 112. Number 7, 113. Number 8, 114. Number 9, 115. Number 10, 116. And number 11, 117. Are there any of those items you want to pull off for discussion?
Number 2, number 13.
I'm sorry, say that again?
Number 2 and number 13.
Number 2 and number 13, okay. Are you talking about item number 7, which is RS 2023's 113?
No.
Okay.
No. Never mind.
Okay.
This two.
Was there another one?
No, right now, just number 2.
Okay. Okay. All right, so I pulled off item number 2, which is RS 2023-108. Anything else?
So I can squeeze that far.
Oh, the deletion. Councilwoman Porterfield need to come in here. All right. All right, I'll go ahead and read the captions on these. Item number 1, RS 2023-101 by Porterfield, Evans, and Prepty accepts a grant from the Tennessee Department of Children's Services to the Metropolitan Government acting by and through the Davidson County Juvenile Court to provide juvenile justice supplement funds to assist in employing a youth services officer. Item number 3. I'm sorry, I don't know why I keep wanting to put item number 3 on consent. It is not. Item number 4, RS 2023-110 by Porterfield, Evans, and Coupin accepts a grant from the Tennessee Department of Health to the Metropolitan Government acting by and through the Metropolitan Board of Health for public safety partnerships in high impact areas to use available data to identify populations at high risk for adverse consequences from substance abuse and employ evidence-based interventions that are responsive to population needs. Item number 5, RS 2023-111, Porterfield, Evans, and Coupin accepts a health promotion services grant from the Tennessee Department of Health to the Metropolitan Government acting by and through the Metropolitan Board of Health to promote Healthy People Goals, a 10-year program of national goals and objectives developed by the U.S. Department of Health and Human Services to reduce disease and improve the health of all Americans. Item number 6, RS 2023-112, Porterfield, Evans, Allens, and Prepty approves a contract between the Metropolitan Government acting by and through the Metropolitan Board of Health and Meharry Medical College to provide public health experience opportunities for its Master of Public Health program students. Item number 7, RS 2023-113, Porterfield, Evans, and others approves a grant contract between the Metropolitan Government acting by and through the Metropolitan Board of Health and the Mental Health Cooperative to provide expertise and staff in emergency behavioral health care to support the Metropolitan Nashville Police Department MNPD co-response model known as Nashville Partners in Care. Item number 8, RS 2023-114, Porterfield, Evans, and others approves a grant contract between the Metropolitan Government acting by and through the Metropolitan Board of Health and the Mental Health Cooperative to provide expertise and staff in emergency behavioral health care to support the Nashville Fire Department co-response model, also known as Responders Engaged and Committed to Help or REACH. Item number 9, RS 2023-115, Porterfield, Evans, and Prepty approves amendments 1 and 2 to the Healthy Start Initiative, eliminating racial and ethnic disparities grant from the U.S. Department of Health and Human Services to the Metropolitan Government acting by and through the Metropolitan Board of Health to provide a variety of services in reducing infant mortality for pregnant and parenting women. Item number 10, RS 2023-116, Porterfield, Evans, and Coupin Approves Amendment 2 to a grant from the Tennessee Department of Health to the Metropolitan Government acting by and through the Metropolitan Board of Health to provide public health activities to enhance the health and well-being of women, infants, and families by improving community resources and service delivery systems available to them. And then item number 11, RS 2023-117, Porterfield, Evans, Bradford, and Coupon approves Amendment 1 to a port security grant from the U.S. Department of Homeland Security to the Metropolitan Government, acting by and through the Office of Emergency Management for equipment to enhance current land-based and maritime response capabilities. Do I have a motion?
So moved.
All right. Okay. It's been moved and seconded. Thank you. And we've also added 2 more members, Carol and Kimbrough. So thank you very much. All those in favor?
Aye.
Anyone opposed? Anyone abstaining? All right. We recommend approval. All right, we're going to go now and pick up item number 2. RS 2023-108, Porterfield and Evans approves agreements between the Metropolitan Board of Health and the Metropolitan Government of Nashville, Davidson County, and the State of Tennessee Department of State for the provision of administrative law judges. Do I have a motion?
So moved.
Second.
Okay, it's been moved and properly seconded. Any discussion?
I'm just curious what an administrative law judge is. And I think you had addressed this for me earlier.
Yes, sir. It's if we have generally these are employee grievances of some sort, and the administrative law judge would function as the judge in a hearing, quasi-judicial hearing to try to resolve that issue.
Is this a change or an add-on? Or is it something we've already got?
We used to use them, and it got dropped somewhere along the line, and we're going back to it because it's actually more functional.
Any other discussion or questions? All right, all those in favor?
Aye.
Anyone opposed? Anyone not voting? All right, we recommend approval. All right, then we're going to go to RS 2023-109, Porterfield, Evans, and Bradford accepts a grant from the Tennessee Department of Health to the Metropolitan Government acting by and through the Metropolitan Board of Health to implement and coordinate activities and services related to HIV prevention, testing, diagnosis, treatment, and surveillance. Do I have a motion?
So moved.
It's been moved and seconded. Any discussion? Councilwoman Porterfield.
Yes, thank you so much, Chair, and Director Sharp, thank you for being here. I've received some questions about this grant, so I just want to make sure that we can just kind of address them for the viewing audience. Can you start off with giving us like an explanation of the grant and what it'll be used for?
So it's, what it says is prevention and treatment of HIV patients. We have, this is the smaller bucket of HIV treatment money that comes through the state. We directly receive a Ryan White grant of like $4.5 million. It comes straight to the health department, which is for a traditional grant area. They call it. It's 13 counties, but we do all the administration. That is specifically for treatment. Almost all that money comes in and goes right back out to doctors and other medical providers for HIV treatments. This is our in-house HIV prevention and treatment program. It's good as a PrEP program. And we've had this grant for many years. The difference now is, I believe, in the last fiscal year, maybe the current fiscal year, anyway, within the last year or two, the state told the CDC no thank you, that they would fund it with state dollars. We were a little concerned about what strings they might want to attach to it or remove or whatever. But the specifics, the scope of services and everything has remained exactly the same with the state dollars as they were when it was CDC money. The one difference for the community that changed because when the state took over the funding of that program is there were some sub-recipients in Davidson County and elsewhere that were receiving money directly from the state health department, passed through CDC money from the state health department. And the state, when it became their dollars, chose to reroute some of that money. And it cost some of the providers in town some amount of money, but that never came to us anyway. It was a route through the state health department.
Thank you. The organizations that lost their funding, are they able to get any funding from the health department? Does the health department partner with any of these organizations? So are they able to get funding, or is this funding strictly for our health department?
This is just for the health department program.
Okay.
We work with these folks a lot. There's a lot of education in that world, as you might imagine. But this money will stay in town.
Thank you. Thank you, Chair.
All right, thank you. How about any other questions?
Did you say this was the PrEP program?
It includes, as part of it, yes, sir.
And did they lose some funding from the manufacturers recently?
That I do not know.
I thought I read where they had lost money, that one of the major manufacturers of these preventative meds had pulled their money. I think they got dependent on it and used to it. So we might want to see if we can.
That was, I know is it Music City Prep? I think it's an NGO here in town. They were having some struggles with various things.
That may be what it was. And this is a different PrEP than that.
It was the same drug. I mean, it's the same program.
Right, but this is our in-house program versus that was an NGO.
Yes, sir.
I think that's what the difference is.
All right. Councilmember Porterfield?
Thank you. It just triggered for the, I used to be a teacher, so for the sake of the people that are watching who may not know what PrEP is, I know we here know what it is, but could you just quickly explain what PrEP is? And I know we know it's a preventative medicine, but
It's a miracle. It's pre-exposure prophylaxis, and it is both prevention and treatment. If everybody took it, AIDS would go away, basically. It's wonderful.
thank you. Thank you so much.
Thank you. Any other discussion? All right, all those in favor?
Aye.
Anyone opposed? All right, we move approval. So now we will go to bills on second reading. We've got BL 2023-70, Coopin, Evans, and Huffman, amend section 13.08.040 of the Metropolitan Code of Laws related to offering of merchandise for sale on or near public property. Do I have a motion?
Second.
It's been moved and properly seconded. Councilwoman Darby, you can do it. Director Darby.
So just to let you know what happened yesterday in, I believe this transportation, this item was deferred for a meeting. There is still some language in the code provision that might need a little further tweaking or further explanation or to be part of the amendment going forward. And so we need to work with the legal department to confirm that, and just wanted to have a little more time to do that. And I think the sponsor is aware, the lead sponsor is aware.
Okay, so we don't need to bother with trying to move the amendment and all that stuff because it sounds like there's going to be other.
There should be another amendment, yeah.
Okay. May I recognize the sponsor?
I concur with
Councilmember Coopin, please.
Thank you, Chair. I concur with the 41st Councilwoman Darby to have a deferral to clean up some of the language.
Are we just doing a one meeting deferral?
A one meeting deferral, yes, please.
Okay. Can we move, anybody move?
So moved.
All right.
Second.
It's been moved and seconded. All those in favor of a one meeting deferral?
Aye.
Anyone opposed? All right.
No one's gotten snake squeezed to death anytime, have they?
Not yet.
All right, thank you very much. All right, and then we have BL 2023-80, Bradford, Porterfield, Gamble, and Evans approves the lease agreement between the Metropolitan Government of Nashville, Davidson County, and Nashville Metropolitan LLC for office space at 1281 Murfreesboro Pike, Nashville, Tennessee. And then the parcel numbers, which I'm not going to read, but they are in the record. Can I have a motion?
So moved.
Second.
Anybody, we've got it seconded, thank you. All those, anybody have any discussion?
I do.
Yes.
I do. We kind of reviewed this yesterday as well. I think this is the same one. Is it, Ms. Porterfield? Did we have this yesterday in budget?
I believe so. Which item are we? Yes.
Yes.
I have a question about the lease agreement. Who can speak to that?
I can speak to that.
Okay.
Benita Davis from Metro Action Commission. It's our agency that's moving into, if approved, into that location. By email or from
Yes, ma'am. And I wanted to know, now is this a new place you're going into?
New from the standpoint, it is not a previously Metro leased property.
Okay.
But it's not a new build or anything like that.
Okay, and what is the lease amount?
The total amount is $9.7 million and some change. for all 10 years. That's the totality of it.
So about 1 million a year?
Yeah, it starts out at about I have a number, 847, and then runs up with a 3-year increment, a 3% increment every year.
Okay, and you're signing the lease for the entire 10 years?
It's a 5-year renewal and into a 10-year.
Okay. Did you all look anywhere else?
Oh, yes, ma'am, we did.
Okay.
There was quite extensive look. We are required to vacate the Clifford Allen building. And so at that point, Property started a search probably two years ago. I've been with MAC for 3 years, and when I walked in, we were supposed to be moving that December. I came in August, and we're still there. So over that period of time, we exhausted all the Metro locations. Our decision in working with Metro Property is it includes making sure that our client base has available accessibility from public transportation, also that we have a hot map to show where the bulk of our customers are currently living and located, so we wanted to be within a certain radius of that. We started with a location, the final location I think Metro presented to us was 44 Vantage Way down in Metro Center. This particular building provides more space because we over the last 3 or 4 years have been increasing our team member population, and increasing our trainings and our accessibility to customers for utilities and rental assistance and our numerous other services that we provide. In looking at that, we wanted to make sure that we wouldn't have to move again in a short period of time. So we found a location working with property, and this location is actually approximately $7 per square foot cheaper than the one that Metro had initially presented to us down in Metro Center. It also includes the utilities in there, all of the supportive services for the building. So this ended up being a location that had minimal amount of build out. It had plenty of already preset offices in there. So the bulk of the monies, the TI going into that is going to be for paint, carpet. I think there may be one wall or so that's coming down. Otherwise, it's much cheaper than a build out that was going to have to take place down in Metro Center. So
What were you all paying at Clifford Allen building?
Clifford Allen, I don't have an answer for that one. But I know it is slightly cheaper than what we were going to do in Metro Center, but I don't know in comparison to where we're going. I don't have that particular answer.
Okay, so it's cheaper than Metro Center, but you don't know about?
Yes, because
This
it's the contract with Metro and Nashville, not Nashville Gas anymore, Piedmont Gas. So I'm not really sure.
And I just have one other question, and I'm not just trying to pick on you.
No, you're fine.
This is just something came up yesterday where we're paying another $1 million a year to rent.
Yes.
And I'm wondering why we don't use, and I'm thinking in my district in particular, I know there are at least 2 schools I know of off the top that are just sitting there and no one's using them. So right now I'm thinking about the one on Kings Lane. It's a nice sized building. It has a nice sized lot. Do you all explore or look at some of the properties that Metro owns prior to going out and like create new,
Yeah, I
paying
understand
out large sums?
Yes, it's based on the amount of space that was needed by Ernst & Young, the analysis that they did, I think, for all of the different departments that are having to move for various reasons within Metro. So we do exhaust. We look at, again, parking. We look at the accessibility, but we do look at buildings. We actually have 2 or 3 of our Head Start centers located in older Metro school buildings. So we do try to exhaust those before we move on. So we did allow first, well not allow, but Metro Property presented things to us. We looked at those. and worked with them to see if any of those would match. Then we continued to look past that, and there were some Metro buildings in that. Now, I do not remember, you're probably talking about Kings Lane School, or what used to be Kings Lane
Right.
School.
Mhm, I was thinking,
Right. Yeah, Robert E. Lillard School.
yes, it's changing names.
Yes, since we live in the same community, so I know
Okay.
exactly what you're talking about. So as far as that particular location, I'm not sure that that one was initially presented to us. I don't remember it being on the list. It may have been. I do not remember that at this time. But we did try to look at all of the buildings that we were aware of in that search.
And do you know specifically of any other building other than the one on Vantage Way? I know you said there, we looked, do you know specifically anything else you all looked at that,
Sure,
well, I'm sorry, the Metro already owns?
the Metro already owns. The school, Buena Vista, old Buena Vista was looked at, the Metro owns. I can't answer anything past that because that's what my memory is pulling for me now. And again, I came on in August of 2020, and my understanding is a search had been done prior to me coming on in 2020. And at that point, I know, again, it was, at least it was a non-Metro property, but it was in Metro Center also. But prior to that, I'm not sure what was exhausted prior to me coming on in 2020.
And so, but you're saying, but this is basically like a 5-year lease?
Let me take this as your last question, because I know Mr. Benton's got a question after you.
Sorry,
If you could ask this question, and I want to let Mr. Benton ask his question.
okay. So you're saying.
It's a 10-year with a 5-year renewable clause inside of the 10-year.
So it's a 5-year base with 5
5-year
option years
option.
after that.
Okay, so you
For a
could
total
end
of
it in
10.
5, is what I'm asking, if you wanted to.
That's what it appears in the lease. There's an option.
Okay, all right, thank you, we appreciate that.
All right, Councilmember Benton.
Since you've had to go through this, does it look to you like there is a move for Metro to start renting and leasing property instead of using our own or owning property ourselves?
I wouldn't make that statement. In my work with them, because we're also looking at possibly relocating a couple of our Head Start centers. We have been presented again with possible other Metro schools and properties. So my experience has been it looks balanced. It looks at what the need is of our agency. I can only speak for my agency, but it weighed the needs of our agency, and from my agency standpoint, our needs are what are the needs of our customers.
Yeah, let me just add that there was a lot of discussion about the lease agreements and budget yesterday, and so I think that's probably something that if you're not on budget, you can come to budget. Chair will recognize you if you're not on the committee, and you can ask those kinds of questions there. And so that's what I would encourage probably going forward, because I think there was probably a pretty extensive conversation related to the Morris Building, kind of in conjunction with all the leases that we're seeing, and kind of how can we look at it holistically, as a council, instead of kind of these onesie, twosie, lease agreements where we don't have a good visibility into kind of the points that you all are bringing up. Any other questions related to Metro Action or anything that they're doing?
I just have one.
Yes, Councilmember.
Welcome to District 13.
That's a statement, not a question. All right, anybody have any other questions? All right, all those in favor?
Aye.
Anyone opposed? Anyone needing to abstain?
I want to abstain.
Okay. All right, we do approval, none in favor, 1 abstention. Could you Anna, would you mind opening the door and see if Pastor Tucker's outside? Thank you. We have, before we get to April and her team, I had invited Pastor Director Davey Tucker from the Human Relations Commission, because with the changes in our committee structure, his department is now part of Public Health and Safety. And so I wanted to invite him to come and share information about his department and anything he wants to give us visibility into as far as how he'll work with us and things we should think about when we're considering legislation. So I'll turn it over to Pastor Tucker.
Thank you, Council Member. We're going to pass around some handouts here. Let me get one of those. It kind of outlines what our work is and the things that we're focused on. The Metro Human Relations Commission, let me just read this from the statute here. The mission of the Metro Human Relations Commission is to protect and promote the personal dignity of all people by protecting and promoting their safety, health, security, peace, and general welfare. That's a broad piece of land right there, and we're well aware of it. And so because of that, in the document that you have, this is part of our strategic planning that has been approved by our commission as it breaks down the various areas that we work toward. On the second page, you'll see what our strategic impact areas are. Equity in Metro, equity in Nashville, reimagining public safety, Title VI compliance, housing and tenant advocacy, and economic development and wages. All of these and a bunch of other things fit within inside the scope of that. And so just briefly to go over what these mean is looking for and addressing equity within Metro. If you just look around in the departments, there's been this effort toward DEI, but you have to do more than say it. You have to do it. And so 3 things that I tell everybody about doing DEI work, if they're committed to doing it, is 1, there's an assumption that something is wrong, or it's an attempt to ensure that nothing goes wrong. 2, it is always disruptive. It's always chaotic. This is not clean work. If anybody tells you that it is, it's kind of like developers who do the minimum to put a LEED sign on their house. They barely meet LEED certifications. They do the least amount of whatever. So it's always disruptive, and it's disruptive because the end result of good DEI work is it will recenter power, period. And so most agencies like to have it as a star or a button to have, but then when they get into it, it's almost always for everybody but the leadership. And so in that way, our department tries to, through research, I have Ashley with me, my colleague, who is the author of the Inclusivics Report, that so we do this by awareness, by training, and even by public hearings. All of that is which is within our statute in which we operate. I personally take it seriously, and even if you look at the numbers that are portrayed in the Inclusivics Report, there are some things that could be done a lot better all the way across the board as it relates to, particularly for Nashville, of which we can show, if we went back historically, of public policy choices that benefited some and excluded others. And many of them still exist to this day. So our agency is there, and maybe that's why y'all don't ever fund us very well. It's because if we were, this is what we do, and this is what we take very seriously. And also equity in Nashville is a much larger issue. As we look at the gentrification of neighborhoods, as we look at the replacement, the allowing of the replacement of, say, starter home type housing and replacing a starter home with a home that's 4 or 5 times that value. If the city was conscious, then we could take steps to not make that be so rampant that you can take a whole neighborhood that was priced around a particular class, and suddenly through gentrification, it's reclassed. And so that the class that was there is now displaced. Those are real things. And I think we often hide behind discussions of, well, that wasn't my intent, but that was the impact. And so MHRC seeks to educate, seeks to engage in ways of making this equitable place for everybody. Reimagining public safety. Prior to the COB, it was the MHRC that was the place for police complaints outside of the police department. MHRC, even after the passage of the COB, it was the MHRC that actually stood up the COB prior to them taking over. We have partnered with them even up to this new thing that they have, which is much, much less robust than what was. But inside of reimagining public safety, it's so easy to look at it as police and fire. But it's much more than that. Studies have shown, and it's universal, you look anywhere around the world where there's abject poverty, it always has certain friends. And these friends are not always crime, but crime is there. The propensity to be a victim of violence, poor health outcomes, food threatened, housing threatened. You look at all of the issues that accompany poverty. And so we seek for ways of not to fall into this idea of defund the police. No, what are alternative ways of making safe neighborhoods? You look at the violence interruption. That is an ideology. Well, excuse me, let me say it this way. Violence interruption is a thing that seeks to embed people close to where the violence is originating from. But violence interruption as an ideology is to take away 2 things from the potential candidates who would be involved. That's time and opportunity. So after school programs within the ideology are a form of violence interruption, taking away time, but also taking away opportunity. So whether it's arts program or music program, I personally have a dislike for sports as it relates to always guiding African Americans into sports as an activity. So that's a personal thing, something for another day. But Title VI compliance is our main thing, and anybody that gets federal funds cannot discriminate on the basis of race. And so we do investigations for that. We can hold public hearings. We can ask the court to issue subpoenas. Our primary role, which again is according to the code, is we act as conciliators. Our win is when two desperate parties can come to an agreement on what will fix their situation. And normally, I think we do pretty well at that. But some issues are systemic. I mean, Health Department, Arts Commission. I mean, you have to know that where there's smoke, there may be some fire. And so those become a little bit tougher. We're involved with them. We also work with HR, with Rozelle. We've worked with Andrea and areas to address that. But Title VI is often overlooked. And even now, as we dealing with the aftermath of the recent U.S. Supreme Court decision that wants to interpret the law in a really, really strange kind of way, it even puts Title VI in jeopardy. But all those things are so new that they're still processing their way through. Housing and tenant advocacy. these have been some of the things that MHRC has done before. We put out 3 different reports. It's interesting here in Nashville that everyone, the long-term housing advocates, blew the alarm 15 years ago because it was lower-income people who were being displaced. They really didn't catch the fire that it has now until it started getting working class and middle class. But that the gentrification and the changing of neighborhoods began with the folks who had the cheapest property. But as it started making teachers and firemen hard to find places to live, the political will around it grew a lot more. But if you look at it, even within this body, with people who've come and gone now, that have been, Bill Barnes blew the horn 20 years ago, because you could see it happening. People who lived in those areas could see it happening. So we produce research and evaluations around housing and advocate on behalf of tenants, particularly during the COVID. We were also part of the advocates that even approached you to fund the Tennessee Legal Aid Society in a more significant way, because folk were showing up in court during COVID and did not have representation. We don't often look at that the same way we do as someone needing a public defender. But the justice system, when you don't have an advocate, you're at a disadvantage. So economic development and wages. Right now we're looking at wage theft, which is a real thing, primarily affecting the Hispanic community. And to me, I wish the police department would prosecute that, of individuals who intentionally go out and hire people with no intention of ever paying them, and then they have no redress in the legal system to address that. So, and the MHRC has very low power of enforcement, sanctions or any of that. And so when people come to us, we're really a place of last resort. Some of the things that we have worked on, we just had a Title VI training for Title VI coordinators around the metro area. I think we had 30 or 40 there. We do investigations into Title VI. Again, as we said, we just put out the Inclusivics. In the Reimagining Public Safety, we used to do a mobile diversity tour with the MMPD, but we've held public hearings around the matter to bring together individuals and community groups to voice what they think would make a safe community. Just Conversations, we just finished today recording 5 or 6 episodes around certain topics, and we thank Councilwoman Porterfield for playing moderator on one of those. Again, as a way of educating, we put, and I think yours was about wage theft, so we put together some professionals to create avenues for people to educate themselves if they want more information about a situation. I could go on and on, but if you look at this outline here, you can see what our priorities that we are currently working on right now. Title VI is always our main thing, but inside of Title VI, that Metro has done quite a bit of work over what was, since we're 15 years out. Actually, this is the year of the English-only vote. This is the 15th year of that. So we've come quite a ways as it relates to language access, but there's still a much longer way we could go to make sure that all citizens, when they're using particularly government services, have it in their language. And software and the ability to do forms and stuff have become so much easier where there's not a bunch of printing that needs to be done. We've had reports of immigrant licensed contractors who hire a English native speaker to navigate them through codes. So suddenly on a project, someone pays extra money just because they're not English first language, but they're qualified, they have their licenses and all of that, but just with the forms. So we've even seen what you've done here in the council chamber over the years of you just added the Spanish, and I heard Kurdish is coming. Arabic, yes. Thank you, Ms. Darby. Now, she keeps everybody in check. I feel special. This is actually the first time in public I've been checked by you, Director Darby. Am I part of the club now?
I'm just very excited that we're offering it, so that's
Yes.
why
Oh, and we are too. And there can be so much more that can be done. Ash, you want to talk just a little bit about the language program that we're involved in now?
Yeah, and then I'd love to take questions, so,
Okay.
but we've probably got like 5 minutes left.
Yeah, we've been connecting departments to resources with the Tennessee Language Center, so they're providing training like for bilingual staff, helping update some of the language LEP plans that departments have in various formats of development. And so we've been providing a lot of technical assistance and really adding capacity through this partnership and some funding that we've been able to leverage.
One last thing, just so we're clear, because I get asked this question quite a bit. Again, I'm reading from the code as far as our duties and responsibilities. To advise and confer with the mayor and other members of metropolitan government concerning issues under its purview, to recommend, draft, propose, and support legislative action to safeguard people within the general services district from discrimination. So it's often hard to address you as a whole group, and that's what the public comment period is that I often use, particularly when there's something on that agenda that you'll be talking about, that I'll stand and speak on behalf of MHRC as it relates to our concerns. And over the time period, I can say that we're being asked more, and that makes it a whole lot easier, and we can submit reports to you. So we've been asked by, and I appreciate you asking us here just to find out who we are, but a couple of the other standing committees have asked us to supply them with information. And when asked to do that, then we appreciate that, because we want to move with this issue of equity. And to say that we have to acknowledge past inequities, and that's so hard sometimes to do, but we're committed to the work, and appreciate this opportunity that hopefully it will influence y'all when we come back around for budget.
Councilmember Huffman.
First of all, thank you for coming. That was extremely interesting. I've always seen you at the back of the room, and it's nice to hear you speak on your department a little bit. Question for you in regards to contracts and how those get divided out through Metro in an equitable manner. Is that something that's within your purview? So, for example, contract goes out to a company to take waste off of a Metro project. Is there sort of some process that your department does to ensure that those contracts are handed out in a way where it's fair, that they're, you know, obviously given a chance to have minorities a chance to get those as well?
Our problem is bandwidth. We have a total staff of 6 people, and but to your point, this council approved for us to be able, MHRC, to name one of the members of the procurement board, and we appreciate that. And to your point, we're glad to have someone in the room that can raise questions, because oftentimes in the procurement process, it's the document that comes out that has the impact that excludes. Something as simple as a $5,000 job, but you want somebody to have $100,000 worth of insurance. I mean, so it's some things is that, some contracts that are so big that can be broken down. A good example of that is the janitorial services that the MMPS deal with, which, for the record, they should have never been privatized. But so yes, but we don't have the bandwidth. We've even talked about projects, and particularly as it relates to economic development, of seeing how we can look at that, how we can take how they're being given out, but Metro has gotten better with at least trying to put in processes to look at that and to constantly keep count of that. And so, yes, we could and we do, but not to that level of specificity.
Okay, yeah, and just for the record, as the East Bank comes along, I think that's going to be something that's going to be extremely important that we keep an eye on. So thank you.
Yeah, thank you.
Any other questions? Okay, I really appreciate y'all coming. Thank you very much for being here, and I look forward to working with you over the next year.
Same to you too, Councilwoman, and thank you again for the invitation. Appreciate it.
Next, we're going to move on, and we're going to hear from the Office of Homeless Services with their update about the $50 million ARP funding.
Thank you, Madam Chair. My name is Bill Clendenning. I'm the grants coordinator for OHS, and I'll give you a quick update. And I do apologize that we did not get this email to you today. We'll do better next time. We were tweaking the report to the end. Wanted to make sure it was right before it went out, so we apologize for that. I'll do a better job of that. This really is a report about increasing momentum. There's a lot of things.
You got a couple extra copies? I think a couple people snuck in.
Okay, I got one. I'm sorry. There we go. Thank you. But we're adding, as we gain momentum, we are adding more information to this report. You'll see under the interim gap housing, for instance, the entries from encampments, which we think is a really nice piece of knowledge. You can see how many people are going from each camp to the interim gap housing. For instance, with Salvation Army, 100% of the people in their interim gap housing came out of camps, the encampments. So that's something we've added. It's very important to watch this. So we're getting to, we're almost a year, we're just a little over a year into this, and supportive services has really, that's where we're seeing the momentum now. All the programs are online. The staffing and the caseloads are increasing. We're still having our meetings with the supportive service providers twice a month. It's a collaborative thing. It's time for them to share. We also bring in speakers, and we're really encouraged because it's experience and idea sharing, but also we hear about the challenges. We're able to address those as well. And then we get to hear the stories of success that are coming out of that, which is really encouraging. The landlord engagement team, there's a full team in place, and they're gaining momentum as well, making great progress. There's 175 properties in the low barrier housing collective now, so that's very encouraging too. And then the $4 million capacity grant, the applications have been received, and we are in the process of negotiating those contracts. We met with each of the applicants, talked to them about the project, wanted to hear in person what the project was about. Then we kind of regrouped, went back, and we've given them conditional terms that if they want to proceed with the funding, that they need to meet the terms. So we're working on that. That'll be in place soon. And then the very last page shows the total funding. You'll see that we're at about 1/3 of the total funding, which we feel like is exactly where it needs to be. The funds are getting to the right people, but we still have the capacity for what's coming down the pipe. Does anybody have any questions?
Remind me, when do we have to have these spent by?
By the end of '24.
Okay.
26.
Oh, 26.
Yeah, some of the interim gap housing contracts end in 2024, but the overall funds need to be spent by December 26th.
Okay, thank you. How about, Councilmember Huffman?
Thank you for providing this. It's always excellent. Is there any restriction on the amount of money that is left in regards to it being used towards creating new housing or renovating current housing? And the point that I bring up, my colleague in District 1 brought up two unused buildings, and that seems like that would make a strong fit for housing on Metro land.
Wait, hold on a minute. We talking about, you mean for to house?
Not specifically yours, but there's a lot of property that Metro owns.
There's a lot of property.
Yeah, I believe that it's all for a very small amount is allocated. So the hope is it will be spent. I don't think there is a plan for anything that's left over at this point.
Yeah, there's, sorry for having this. Most all of these funds actually have contracts on them, so it's not like just sitting in our budget at this point in time. So most of them will have contracts on them. The only amount that is not already allocated would be, it's allocated for MDHA. I believe there's about 13 million that's allocated to MDHA for the Affordable Gap Loan and Permanent Supportive Housing. So there was a resolution that earmarked 25 million for them, and this is the amount that they've spent thus far. Second round of the RFP process ends at the end of November, so we'll see at that point how many other contracts come in. But all of the other funds actually have a contract on it with an agency and a allocated amount.
Excellent, thank you.
I have one question.
Go ahead, Councilmember.
Can I ask one of these?
Absolutely.
Of course. Thanks. Sorry. Thank you.
I wanted to, I was looking at the very last page under other homelessness news and talking about the camp closures, that first item where it says 13 have exited to homelessness mostly from the recent camp closure. Is that the truck stop camp closure that had that higher percentage of people?
Mm-hmm. And that is transposed. I think it's 9 people and 13%.
Oh, okay.
It is. Yeah, I gave a report to Shelter Committee the other day. So it's 9 people and it's 13%.
Okay.
And I think for the TA truck stop, what we realized was we tried to funnel a lot of people into the mobile housing navigation sites. And once they heard their friends went, the remaining friends actually went to the hotel. That was a better viable option for them. Also, we are working on lowering barriers at the mobile housing navigation sites. You know, in order to be housing first, you really need to have absolute lowest amount of barriers. But you know, you may know there is some litigation going on for having extremely low barriers. So trying to figure out a great way to push and pull evenly. Yeah.
Okay. About any other questions? Okay. Well, I appreciate the update, and we'll look forward then for the next month for an email version in advance. Okay, cool, I appreciate that. And I'll put a note on my calendar to send you a reminder, because I've totally forgot about that, so I'll take ownership for that. Anything else for the rest of the group? I will let you know at our next meeting, December 5th, we'll have Diane Lance from the Office of Family Safety. He'll be here giving a more generalized overview about her office and the work that they do in the community. And with that, I hope everybody has a nice Thanksgiving. Thank you.